and welcome everybody. If you're just joining us, please enter your name and organization into the chat, as well as what state you're from. We'll give it just a minute and then we will get started. Again, if you're just joining us, please enter your name and organization, as well as the state that you're from, into chat, and we will get started. Welcome today. My name is Nikki Hale, and I'm a quality improvement facilitator with Telegen. Today's Nursing Home Quality Essentials is going over person-centered care, a pathway to health equity. Before we begin, I want to make sure that you guys consider adding our QI Connect website if you're not already joined. To your trusted list of emails, and then also follow us on social media. We're on Facebook and LinkedIn. We also encourage you to sign up today for our listserv, where you can get notifications of critical updates from us, CMS, and the CDC. You can also receive information about trainings like these and engage in peer-to-peer sharing with other nursing home teams. We also encourage you to come to our or go to our assessment dashboard. You can fill out these assessments, COVID-19 emergency preparedness, and then kind of assess your strengths and weaknesses and identify any gaps that you may have. One of these assessments proves useful for this session today, the Health Equity and Class Framework Assessment. We encourage you to participate in those assessments. Again, I'm Nikki Hale, and this session is on person-centered care, a pathway to health equity. So we will get started. So our objectives today, we're going to define person-centered care and health equity. We're going to explore strategies to implement person-centered care and to promote health equity. We'll also identify potential barriers in implementing these. And we're going to explore how person-centered care and health equity intersect and they mutually support each other. Lastly, we will highlight the benefits of person-centered care and health equity within your facilities. So first off, I'd like to ask you all a question. And I'm really curious about this one because it can mean so many different things in different facilities, but what does person-centered care mean to you and to your facility? You can drop your answers in chat, or you can come off mute and talk. We encourage participation in these sessions. I'll give everybody just a minute to answer. Anybody want to answer it? Okay, so we'll move on. So before we define what person-centered care is, let's discuss what a resident may feel when they're being admitted to a facility, whether it's long-term care, SNF, behavioral health. Imagine that you're living at home independently and you're able to make your own choices, meet your own needs. You decide when you go to the bathroom. You decide when you take your shower, when you eat. And then gradually or suddenly, something changes that requires you to depend on people for care or to be admitted to a nursing home. How would that make you feel as an individual? Someone who takes a lot of pride in being independent, a lot of our residents do. So suddenly you're dependent on others. To most people, that would make them feel very isolated, stripped of their choices, unseen, possibly unimportant, and possibly forgotten. And I would imagine there would be some anxiety and depression, and the list goes on and on of the feelings you may have. So as healthcare providers, there's something we can do um, to help residents, to make them feel a little more at ease during this difficult transition, and also while they're entrusted in our care. We can provide person-centered care and focus on equitable healthcare by identifying their wants, their needs, and include them in the care they receive. Give them the choices. Let them help make those decisions. So, what is person-centered care? Person-centered care refers to an approach that prioritizes the individual needs, preferences, and values of residents. It emphasizes respect, dignity, and active participation in care planning and decision making. This approach involves understanding each person's unique history, interests, and goals, fostering meaningful relationships between staff and residents, and creating an environment that supports autonomy and well-being. So as we just identified, person-centered care involves tailoring care to meet the individual needs, preferences, and values of residents. Now we're going to discuss a few ways that we can implement that person-centered care within our facilities. So the first thing we can do is provide those individualized care plans. So you're going to need to interview your residents, your family members, friends of residents if need be. So then you can develop those personalized care plans based on each resident's unique history, their preferences, and their health needs. And then you're going to want to regularly update those to reflect the changes in the resident's condition as they may decline, improve. They just may change their mind on something they like. Uh, so then we're going to give the residents the choice and provide that autonomy. So allow those residents to make choices about their daily routines. I know it's really hard sometimes in nursing homes because we get so structured. Allow your residents to decide what time they want their meal or what activities they want to do, when they want to go to bed. For example, you have a resident that may have worked night shift his whole life or her whole life, and then they get admitted to your facility and they're used to staying up till 2 or 3 in the morning. But yet we tell them lights out at 9 o'clock. That doesn't work well for them. It's a huge adjustment to come into a facility, but then to have to change our daily routines that we've had our whole lives is even more taxing on the residents. So with this resident, you can provide them some activities to do during the night. Maybe have them help you up at the nurse's station, fold some linen, do something to keep them busy at night. And then offer them a late breakfast or a brunch instead of having to get up at 7 in the morning. Also, we want to offer a variety of meal options to cater to the individual tastes and dietary requirements of our residents. We want to provide personalized activities and programs that reflect the interest and hobbies of residents, such as gardening, music therapy, art classes, book clubs. Encourage your residents to participate in social and recreational activities that they enjoy. Then providing that holistic care, addressing not only the physical health needs of the resident, but also their emotional, social, and spiritual well-being. Um, we need to provide access to mental health services if possible. Call their pastors. Their spiritual care is really important to them if they, whatever they participate in, offer that spiritual care. And then provide those social support networks that they are used to engaging in. Also, we talked a little bit about individualized care plans, but resident involvement in care plans, not only creating individualized care plans, but involving the residents in those decisions that we make during that process. So involve the residents and their family members in the decision-making processes regarding their care and what treatment options they have. And then, of course, as I said earlier, hold those regular meetings with residents and families to discuss care plans and also to open up an avenue for any concerns that they may have or any new ideas that may be needed or wanted. Other ways we can implement person-centered care is providing comfort and familiarity for our residents. Create that home-like environment. Allow them to personalize their living spaces, whether it's bringing furniture, which I know sometimes is not feasible with a fire marshal, but little things like a little table or photos, decorations, make it homely for them. Encourage a sense of community and belonging among residents and staff. Examples of this would be like ice cream socials, bingo, social groups with the residents' interest in mind. And then we want to provide consistent caregivers. And I put in quotations whenever possible because I know this is a difficult one. I know staff turnover is a huge thing, but whenever possible, let's assign the same caregivers to the resident. This helps build that strong, trusting relationship and opens that line of communication and helps the resident not feel so isolated. And then you want to train those caregivers to understand and respect the preferences and routines of each resident. And then also effective communication. Ensure that staff communicate clearly and respectfully with residents, taking the time to listen to their needs and concerns, not to dismiss what they're talking about. We want to also offer communication aids and tools for residents with like hearing impairments, speech impairments, cognitive impairments. And then, of course, offering exercise programs, wellness classes, preventative health services tailored to meet the needs of that resident. Provide access to rehab services. I know most of us do have PT, OT, and ST, but provide that access to them. Let those residents engage in some physical activity, restorative care, also, family and community engagement. This is perhaps probably one of the most important, in my opinion, is encouraging those family members to stay active and to be actively involved in the care and social activities of the resident. This reduces isolation. And build partnerships with your community and organizations within your community to enhance the resources and services available to your residents. All of these practices help create a supportive and respectful environment where residents feel more valued and cared for as individuals. Also, I wanted to mention, I put the link on the bottom of this slide, but there's another resource for implementing person-centered care through culture change. It goes hand in hand, and that is through the Pioneer Network. And I've created, or the link is on the bottom of your slide, and you will be getting a copy of these this Friday, I believe. Okay, so according to the US Census Bureau, the US population aged 65 years and older is expected to nearly double over the next 30 years, from 43.1 million in 2012 to an estimated 83.7 million in 2050. These demographic advances have left our healthcare system behind as they struggle to reliably provide enhanced or evidence-based practice to every older adult at every care interaction. So the age-friendly health system is an initiative designed to meet this challenge head on. Um, they aim to follow an essential set of evidence-based practices throughout all healthcare settings. They aim to cause no harm, of course, and to align with what matters to the older adult and their family and caregivers. Um, so as you can see, the diagram kind of goes over what matters. So first of all, the first M is what matters. The M is matters. So to know and align care with each older adult's specific healthcare outcome goals and care preferences, including but not limited to end-of-life care across settings of healthcare. So then the next M is medication. Um, and I feel like this is really important to facilities as well because we want to determine if the medication is necessary. Is it age-friendly medication that doesn't interfere with what matters to the older adult, their mobility, or their mentation across the whole setting of care? And then, of course, mentation. We want to prevent, identify, treat, and manage dementia, depression, and delirium across, of course, all healthcare settings. And then lastly, but not least, is mobility. Ensure that older adults move safely every day in order to maintain function and to do what matters to them. Again, I provided the link to this 4M framework. and I encourage you to look it up and study on it. It's really resourceful, especially for our geriatric population. Okay, so now that we've discussed a little bit about person-centered care, let's talk about potential barriers. First of all, I'd like to know, are you guys developed or have you developed and implemented person-centered care in your facility? And if you have you met any challenges or barriers? So I'll give everybody a couple minutes. You can come off mute or you can drop your answer into chat. Give everybody just a few minutes.
Hi, this is Nancy Corsentino. Some of the barriers we've experienced is, we try to give preferences on when they want to wake up, when they want to bathe, and their bathing preferences. But we're finding a lot of people want to bathe at the same time, and
Yeah.
we're having that challenge. Everyone wants to do it before breakfast, and it's such a busy time for the CNAs. We actually even have bathing aides hired, just that's all they do, but we still can't keep up with the demand. And so we're trying to work with them, giving them different days or different times, but it's sometimes I feel we're just not meeting their preferences when we can't do it all.
Yes, I totally understand that, Nancy, and that is a challenge in every long-term care facility. I think is probably the most important challenge is the bath challenge, and I think it has been from the beginning of time. So, were there any other responses?
Not at the moment.
Okay, thank you, Heather. I forgot to mention Heather is monitoring chat for me, so alrighty, so let's discuss some potential barriers to implementing this person-centered care in your home. Number one, and I kind of chuckled when I was writing this because number one is staffing issues, right? If we had tons of staff, we could make all of these things happen. But insufficient staffing levels can lead to higher workloads for your staff that are there, and it makes it difficult for your caregivers to give that individual attention to your residents. And then, of course, high turnover rates. So frequent changes in staff can disrupt the continuity of care, and it hinders that strong relationship that we're trying to build between caregivers and residents. Training and education. Lack of training specifically. Staff may lack the adequate training in person-centered care principles and techniques. And then resistance to change. We all have those nurses that have been there for 20 years and they don't like change, and it makes it a little bit hard uh, to adapt to change, especially when you're used to doing it a certain way. Resource limitations include financial constraints. Limited funding can restrict the ability to provide those personalized services, activities, and environments. And then your physical environments. Older facilities may not be designed to support person-centered care. You may lack private rooms, or you may not have adaptable spaces for individualized activities. And then, of course, we have our organizational cultures. For those of us that come from corporations, the traditional hierarchical structures, a top down management style can stifle staff input and creativity in providing this personalized care. And then, emphasis on completing tasks efficiently can overshadow the importance of building strong relationships and understanding those residents' individual needs. Next is regulatory and policy barriers. So, strict regulatory requirements can sometimes prioritize compliance over individualized care, and that limits some flexibility within your staff. Um, then, of course, the documentation demands. How many of us sit and document for hours on end? That extensive documentation can sometimes take away time from that direct care that those residents are seeking. Communication challenges, the difference in language and communication styles between the staff and residents can impede understanding. And then also your residents with dementia or other cognitive impairments may have difficulty expressing their preferences and needs. And that's when you would want to lean on the families. Then next would be your family and resident expectations. Your family and residents may not agree on what care they want to receive. So your family may expect something different than your resident, and that can be a challenge to balance. Um, Also, the lack of involvement with family members. It makes it hard if you have a dementia resident and their family is not involved. And so you're playing the guessing game on what they might like or they might not like, and it's kind of trial and error. Um, so we really need to try to involve residents if possible, if they're available. And then measurement and evaluation. It can be difficult to measure the outcomes and effectiveness of person-centered care, and that makes it harder to justify the changes that you're wanting to do to your for your stakeholders. And then limited feedback mechanisms, insufficient systems for collecting and acting on feedback from residents and families can impede continuous improvement efforts. Addressing these barriers requires a multifaceted approach, including investing in staff training and retention, fostering a supportive organizational culture, and adapting policies and regulations to allow for that flexibility. And then ensure adequate resources are available to support person-centered practices. So now that we've discussed person-centered care, we're going to move into health equity a little bit. The two of these go hand in hand, and they're closely related concepts. They both aim at improving healthcare outcomes by addressing the unique needs of individuals. Often individuals perceive health equity as a separate topic from other services or care that's provided in your nursing home, but there's a way to integrate health equity in everything you're doing, including person-centered and directed care. These are a few ways that they intersect and support each other. Both, of course, have respect for the individuality, holistic approach, inclusive decision-making, tailored care plans. Patient-centered care and health equity intersect by both addressing barriers and disparities, cultural competence, access to services, and then they both align on outcomes and benefits. Both of them have improved patient satisfaction as well as overall better health outcomes. Okay, so let's discuss some key strategies for promoting health equity and long-term care. So health equity and long-term care, as we discussed, ensures that all residents, regardless of their background or circumstances, receive fair and just care that allows them to achieve their highest possible level of health and well-being. Achieving health equity and long-term care involves addressing disparities in access, quality, and outcomes of care. So let's begin with cultural competence and sensitivity. Um, Training, you want to provide that training to your staff on cultural competence and sensitivity. Telligent has a really resourceful, and this is what I was talking about at the beginning, implementation guide on the class, the culturally and linguistically appropriate services. It's on our health equity website, and I have it linked to this slide. And then also you want your language services, offer translation and interpretation services to help overcome those language barriers that we've talked about previously. And then, of course, the individualized care plans conduct thorough assessments that consider cultural, social, and economic backgrounds of the residents, develop those care plans to the unique needs of each resident, incorporating their cultural practices and values. And then health literacy and education. We want to develop and implement education programs that enhance the residents' and families' understanding of the health conditions and the treatments and their care options. We also have a tool on our health equity website regarding health literacy. There's multiple tools and resources available. I encourage y'all to join there and look at these. Another thing would be access to resources. We want everyone to have access to medical care, any recreational activities, social support, and anything that they would want to do outside of your facility. We want them to have access to that within reason, of course. And then collaborate with community organizations to provide those additional resources and support to the underserved populations. I think of Oklahoma, the state that I'm from, and the Native population. A lot of our natives love beadworking and things like that. There's a lot of little museums that do beadworking on the weekends. Provide your residents with that access. And then resident and family engagement, I think that goes back to what we were speaking about before. Basically, give them the choices, ensure that their voices are heard and respected, and use this feedback to drive those improvements in your care. Addressing social determinants of health, and such as transportation, housing, nutrition, social support, all of these overall impact the residents' well-being. And then preventative health services, of course, we want to provide access to screenings, vaccinations, anything that the resident may need. And last, probably but not least, is policies, inclusive policies and practices. So we want to implement and enforce policies that prohibit discrimination based on race, ethnicity, gender, sexual orientation, disability, or socioeconomical classes or status, sorry. And then promote diversity in your hiring practices to create that workforce that reflects the resident population. And that can provide culturally sensitive care to your residents. So, implementing person-centered care and promoting health equity and long-term care offers numerous benefits, and I'm not going to go into each of these because we're running short on time, but the main benefits of both of these is first is, of course, improved health outcomes, enhanced quality of life for our residents, increased resident satisfaction, stronger relationships with your residents, staff, family, everyone, reduced healthcare cost, enhanced staff satisfaction and retention, better compliance with regulations, and community trust and engagement. By integrating the principles of person-centered care with a commitment to health equity, healthcare providers can create more inclusive, effective, and compassionate care systems that cater to the diverse needs of all individuals, ultimately leading to a healthier and more equitable society, as well as a stronger healthcare system. Telegen has a lot of health equity resources and trainings and tools to support your quality improvement efforts. Attached is the flyer. This is our most recent health equity flyer, and you can scan the QR code or you can visit the website, telegenqiconnect.com/health equity for these resources. I encourage you to do that, and then you can always reach out to us for any one-on-one technical support. We will get in touch with your point of contact or with someone who can help you, and we will be happy to assist you in these quality improvement efforts. So with that being said, are there any questions?
Nothing in chat.
Okay, I'll give everybody just a couple more seconds. If you guys go to the website and you think of some questions, feel free to reach out to us. That's what we're here for, and that's why we have these, is to bring awareness and to help support you in these endeavors. Okay, so you can contact us. Here are our websites for general inquiries, the QI Connect at telegen.com or the nursing home at telegen.com, or you can email me and I can connect you with your point of contact. Again, I want to remind everybody, this is our Nursing Home Quality Essentials. We have these every Tuesday and Thursday, 11 Mountain Time, noon Central. This Thursday, we will be discussing Immunization Awareness Month as August kicks off. And then Tuesday, we'll be going over the website for Centers of Excellence for Behavioral Health in nursing facilities. And then Thursday, August 8th, we will be going over infection prevention and control. So please join us with these wonderful teachings that are coming along. And if no one has any questions or anything else that anyone would like to add, I want to thank you guys. And then as a reminder, at the when I disconnect us, you're going to have a post-event assessment that pops up. Please fill this out. This is how we know what we're doing with these trainings, and we know where to gear our efforts in these trainings for you guys. Again, I want to thank you guys for joining us and have a lovely day.